Hi, Mr. My name's Dr. Thacker. Do you mind if I examine you? Would that be all right?
Yes.
Lovely. I'm just going to uncover you. Okay? Thank you. So what I'm going to do, I'm going to have a look at you first, and then I'll carry on and examine your heart.
Yeah.
All right. Lovely. I'm going to start with your hands. Do you mind if I take this hand? Lovely. Lovely, thank you. Good. Have you got any pain in your shoulders?
Yeah.
Okay, I'm just going to lift your arm up. So if you just relax it, and I'll lift it up. Lovely. Great. That's fine. Thank you. At this point, I'd normally check the blood pressure. If you wouldn't mind just turning your neck that way and just relaxing, that would be great. Thank you. If you just relax your neck for me. Great. Thank you. Lovely. Just going to have a look in your eyes. Just open your eyes for me. Open your eyes for me. Lovely, thank you. Just look in your mouth. Just stick your tongue out. That's great, thank you. Do you think you could just lean over a little bit for me? That's perfect, that's great. Okay, and just back. Great. Just going to have a listen to your heart now. Do you think you could turn over slightly towards that side? Lovely, thank you. Great. Now do you think I can sit you forward? Can I just sit you forward? Would that be all right? Okay, brilliant. Now if you take a deep breath in and out. Okay. That's fine. Breathe normally. Great. Just going to listen at the back. So take some nice deep breaths for me. And again. And another one. Thank you. That's fine. Just lean back for me. That's right. Just rest back. Great. I'm just going to have a look at your legs. That's lovely. Lovely. Thanks very much.
Okay.
Thank you. Let's just cover you up. On examining Mr. it's clear he has features of trisomy 21, and that should already alert you to the sorts of conditions that this gentleman might have. He also has a scar, which is a very important finding, and in addition to the trisomy 21, that might indicate a form of congenital heart disease. It's also important to try and establish, when examining the patient, if there are any features of cardiac failure or infective endocarditis. When I examined him, I had these features and these concepts in mind to try and demonstrate to the examiner exactly what I'm looking for. This gentleman had a fallot repair, and he in fact has two murmurs. He has a ventricular septal defect, and you can hear a pansystolic murmur at the lower left sternal edge, and also he has pulmonary stenosis, and you can hear that in the pulmonary area, which is louder as the breathing varies. I examined him from a cardiovascular point of view. On general inspection, he had features of trisomy 21. Important findings on examination were that he had a normal pulse with a normal pulse rate, rhythm and volume. There was no evidence of cardiac failure or endocarditis. He had two cardiac murmurs. One was consistent with a ventricular septal defect, as it was a pansystolic murmur heard all over the precordium. In addition, he had a murmur loudest in the pulmonary area, which is loudest in inspiration. These features are consistent with a repair of fallot tetralogy. So this is an interesting case, and the examiners will like you to recognise that the gentleman has trisomy 21, and that should ring alarm bells as to the sort of cardiac diagnosis he may well have. Patients with trisomy 21 often have VSDs or tetralogy of Fallot. You can see in this case that he's had a stenotomy scar and therefore had cardiac surgery, and it's very likely he's got congenital heart disease. Important findings you must mention to the examiner are whether or not he has features of endocarditis, as well as whether or not he's in heart failure. Now, he has quite complicated murmurs. You're not necessarily expected to diagnose the murmurs, but it's important to describe them to the examiner as best you can. It's also important to describe their location, their loudness, and whether or not they're systolic or diastolic, and whether they're pansystolic or ejection systolic. The examiner may then ask you some questions once you've presented your findings. One of them may be, what are the features of trisomy 21? And indeed, as this is a cardiovascular case, what are the features of fallot tetralogy? Now, given there's a VSD murmur there, the examiner might want to know whether or not this is a significant VSD. In other words, whether the patient has Eisenmenger syndrome, and of course, whether or not the patient is in heart failure.